To look a little more into the neurotransmitters used in the autonomic nervous system, let's take a look at what we have here. We have acetylcholine, ACH, and we have norepinephrine. Now, both of these, acetylcholine and norepinephrine, are used in the actual autonomic nervous system. But their effects can vary. The effects will be based on different receptor types. They can be excitatory or inhibitory. If they're excitatory, that means you're trying to get closer to that threshold to stimulate a response, stimulate an action potential. But if they're inhibitory, we're trying to hyperpolarize, get further away and prevent a signal. So we need to look at what's doing what and how this kind of works in the system. So I'll first start off with where they are and where they're found. Acetylcholine is released by all preganglionic axons. So it doesn't matter if it's sympathetic or parasympathetic, acetylcholine is what's being released by that neuron. And it's also released by the parasympathetic postganglionic neurons. Now, that's only the parasympathetic. Sympathetic postganglionic do not release this. So acetylcholine, all preganglionic, and then sympathetic postganglionic. Norepinephrine, that's the NE, norepinephrine, is the sympathetic postganglionic axons. So that one's a little unique there because we have a different neurotransmitter. So we're looking at the sympathetic postganglionic axons, or remember, could be a gland, that's the adrenal medulla, is releasing norepinephrine. So we're releasing norepinephrine from the postganglionic and the actual gland of the adrenal gland there. So acetylcholine and norepinephrine. We know we've talked about cholinergic receptors. We know that acetylcholine is the cholinergic system. The receptors for acetylcholine, remember, are muscarinic and nicotinic. We've already mentioned this. Hopefully it rings a bell from previous videos. We know they're named after the drugs. So that means nicotinic is named after, nicotine. Muscarinic is named after muscarine, the mushroom poison. So these muscarinic receptors, to activate them, muscarine can activate. Well, that's the mushroom poison. Or acetylcholine, of course. So all of the parasympathetic effector cells, that means anything the parasympathetic system is innervating, those are the effector cells. Those have these, as well as some of the sympathetic effector cells. So the muscarinic receptors are found in the parasympathetic effector cells. Most cases, they're excitatory. So for the vast majority of these receptors, they're trying to stimulate an effector response. So stimulate another action potential. Except there is a notable one that's inhibitory. The cardiac muscle has inhibitory muscarinic receptors. So that would slow and prevent signals. Now, the nicotinic receptors. Well, sure, they can bind with nicotine and be affected, or acetylcholine. Now, they're found on all ganglionic neurons. So all the ganglionic neurons, which means those postganglionic neurons, the ones that are the second neuron in the chain, all have these nicotinic receptors. Which makes sense because both the sympathetic and parasympathetic preganglionic neurons secrete acetylcholine. But also, the adrenal medulla is going to have these receptors as well. Now, remember, the reason for that, in the sympathetic system, you can have a preganglionic neuron forming its synapse with the adrenal medulla, the gland. So they have to be able to receive that neurotransmitter. So that's the adrenal medulla, which is the middle or inside of the adrenal gland. And these are always excitatory. They're always going to try to stimulate a second response. So they're trying to reach threshold, create a new action potential, and have it sent off down the neuron, or causing the gland to secrete a hormone or a neurotransmitter. Now, in the case of norepinephrine, so that, again, the NE is norepinephrine, there's alpha and beta receptors. The alpha receptors are stimulatory, while the beta are going to be typically inhibitory. So instead of having them named for what they bind, what chemical, it's simply alpha and beta in this case. All right, so let's look at some effects. We've mentioned a few possible effects previously, but I'll go through a few more. Increased alertness. This is now sympathetic effects. Increasing alertness is your hearing's heightened, your eyesight's a little sharper, your sense of smell is a little keener. Your entire sensory input is trying to figure out what's going on around you and taking every bit of information that's possible. Increased activity of cardiovascular and respiratory. Well, we're increasing our heart rate, increasing our breathing rate, increasing our blood pressure. BP is blood pressure, HR is heart rate. The whole entire system between the respiratory and cardiovascular are getting your body in a state where it can respond quickly and have the energy necessary. Because more blood's flowing, more oxygen's flowing, you're ready to power those muscles. And by powering the muscles, they get preset almost. They increase their muscle tone, which means they're a little bit more tight, a little more toned, ready to respond and a little bit faster. Now, muscles are to respond almost instantaneously. So this is more of trying to respond fractions of a second faster. But sometimes fractions of a second can make a difference. Feeling of energy and euphoria. As your body is coursing with all this system, all of this sympathetic innervation, your body can feel sometimes a euphoria of just a greatness of feeling. Hey, I can do anything, I can be anything I want, do anything I want. That's the sympathetic nervous system. Dilation of pupils. We already said you've increased your senses, but by dilating the pupils, that allows more light into your eyes to take in more detail. Parasympathetic nervous system. Constrict the pupils. Well, sure, we're doing the opposite of what the sympathetic is. Constricting the pupils makes them smaller. Less light, you're not going to be quite as keen on the eyesight. It's not saying you have bad eyesight. It's just not that heightened sense that was before. Increasing the digestive system. Now, your digestive system has a whole lot going on here. So now you're increasing secretions. Because to digest your food, you're secreting all these different enzymes and chemicals that help break it down. Increasing hormones. Because there's hormones inside your GI tract or your digestive tract that's meant to help stimulate different parts to activate at different times. You're increasing smooth muscle of your digestive tract. Again, you've got to move this food down your esophagus, through your stomach, around through the small intestines, into the large intestines. All this movement is because of the smooth muscle. And then stimulating defecation. Whatever your body cannot use, you need to get rid of. And now, not using could be things like fiber, you can't break it down. Or it could be excess nutrients, there's too much protein or too much carbohydrate or too much of whatever. It's whatever your body cannot utilize needs to be removed. Constriction of the urinary bladder. So you're contracting the urinary bladder, trying to get rid of the urine, trying to stimulate more filtration. Constricting the airways. When you constrict the airways, the lungs are breathing a little more shallowly. So less air is coming in and out, everything's a little calmer. Your heart rate slows down. Makes sense. You don't need to have as much blood pumping through your body, so the heart rate slows down. Sexual arousal. Now, this one might sound a little bit counterintuitive because it's not calming down, but it's something that would not occur in a fight or flight situation. It's only when the person or the individuals are more in a calm state where that can actually take place. So, a couple different things of the parasympathetic system. So that's sympathetic and parasympathetic. Both are innervating the same organs and the same glands, but now that's all found under the autonomic nervous system.